हाय ऑल, मैं हूं डॉक्टर पूर्णिमा सांगवान एंड यू आर वाचिंग द चैनल with health versus lifestyle, and this is web series on diabetes, part 4. In this part we are going to discuss about the type of diabetes, type 1 and type 2, and what are the difference between them, and what are the sign and symptom of diabetes and how they occur in body, and what is the difference between sign and symptom of type 1 and type 2 diabetes, so they can help you in your clinical practice. So without wasting time, let's start quickly. Okay, in this first slide, as we are seeing, there are the two type of diabetes, type 1 and type 2. And type 1 diabetes, it's known as insulin dependent diabetes mellitus, because there is absolutely deficiency of insulin take place in this kind of diabetes due to a number of causes, and those causes we discussed already in the part 1 of this web series. You can go through that. Or very basic cause, if I will tell, that is the genetic factor. Due to genetic factor, there is a absolute deficiency of insulin hormone, so this is called as type 1 diabetes. In type 2 diabetes, this is known as the non-insulin dependent diabetes mellitus. In this, partially or relatively deficiency of insulin hormone due to a number of reasons, and one cause, if I can highlight, that is the lifestyle of a person. Second point, it is also known as type 1 is also known as juvenile onset, because it occur in below 30 year of age due to genetic causes. And type 2 diabetes, it is the maturity onset, because it occur at above the age of 30, because due to lifestyle changes or lifestyle modifications. Okay, in this slide we are seeing type 1 diabetes, it associated with other autoimmune diseases, and type 2 diabetes, it is not associated with any other kind of autoimmune diseases. So what is autoimmune? When body immunity starts work against the body or against the immunity itself, so it is known as autoimmune disease. Okay, next point, second and third point we are going to discuss together, because they both are related in type 1 and type 2 diabetes. In type 1 diabetes, it is acute metabolic syndrome which leads the sudden death in the patient, because it having the sudden complications and which are fatal and which leads the death and which occur suddenly. And the example is ketoacidosis, and second example is hypoglycemia. So these both terms we already discussed in part 3rd of this web series. You can go through by that and can understand these both too. And very briefly, if I will tell you, ketoacidosis is the destruction of fat metabolism due to insulin deficiency, and hypoglycemia, it is sudden dramatically decrease of blood glucose in the patient who is having the insulin deficiency in the body. In type 2 diabetes, it having the chronic metabolic syndrome, and it leads the complications, not sudden death, very slowly, gradually irreversible complications occur in the patient if he or she not bother about his or her lifestyle or medication or yoga or exercise, anything. If he is not going to bother, it lead the slow complications and irreversible complications. And the example is diabetic retinopathy, diabetic I can say peripheral neuropathy, and next one is gangrene, and so on. And all these we are going to discuss in the upcoming videos, all the complication, how it occur, and what treatment we can give, and what prevention and control we can give to prevent all these complications. But first we are seeing the difference between the type 1 and type 2 diabetes, so we should focus on that. So what we discussed in this is chronic complications can occur. And the next point, type 1 diabetes, it is not associated with the obesity, because patient comes to you in a very lean or thin situation, so we can easily understand this is type 1 diabetes case. In type 2 diabetes, it is associated with the obesity or under activities, like because it occur due to the lifestyle changes. So patient may found as obese or may not be found as not as obese, but in most of cases patient found as obese only. In next point, it is type 1. In type 1 diabetes, it is very common in men, and type 2 diabetes, it is very common in women, because due to menstruation cycle, if we will correlate with this, it happen in that, because the cleanness of the body can take place. We can take it as one consideration. And next one, in this genetic history not found in type 1 diabetes, and in type 2 diabetes genetic history can be found. Okay, in next slide, as we are seeing it, type 1 diabetes having the sudden onset, type 2 diabetes having the gradual onset, because due to their different causes. In type 1 diabetes, patient is usually having the thin build. In type 2 diabetes, patient having the obese build or non-obese also, means the patient must not be very much thin or lean, he can be normal or obese. In type 1 diabetes, obesity is not having the risk factor, as we discussed earlier. In type 2 diabetes, obesity is a risk factor. Okay, in type 1 diabetes, it is related with the HLA, that is human leukocyte antigen. It is a kind of gene which is encoded with the major part of genetic predisposition, which leads the type 1 diabetes only. There is no relation with the type 2 diabetes of this DNA. And next point, if you will see, okay, in this type 1 diabetes, beta cell damage can occur. By this, what will happen, there is a complete insulin deficiency take place, because beta cell secrete the insulin hormone. In type 2 diabetes, the tissue resistance of insulin take place. Due to that, partial or relevant insulin deficiency take place, but not the complete one. In type 1 diabetes, acute complications can occur. In type 2, chronic complications can occur, which we discussed already. And what are the acute complications? That is ketoacidosis in type 1 diabetes and hypoglycemia. In type 2 diabetes, there is no ketoacidosis take place, or hypoglycemia can take place in type 2 diabetes, but not severe ketoacidosis take place, because there is the partial lack of insulin hormone, not the complete lacking of insulin hormone. So type 1 diabetes, if we are seeing the treatment, there is only the treatment in insulin injections, diet, exercise and yoga. In type 2 diabetes, treatment is oral drugs for control the insulin hormone or to enhance the insulin hormone, diet, exercise and yoga, and insulin drips can be given if critical situation or any critical complication can occur, may can occur. So in that, we can going to give the insulin drips to the patient. In type 1 diabetes, it is of three kinds, which we discussed in previous videos also, and we will going to discuss them in very briefly or and shortly. So first one is ketosis prone diabetes. It is especially seen in Western countries. It having the sudden onset, and due to viral infection is also can be found in the patients, and patient leads to the lapse, or we can say patient went to the coma. Next one is ketosis resistance diabetes. It found in tropics and in India. And next one is pancreatic calculi, diabetic with pancreatic calculi. This is found in basically in South India. In young patient it is found, and patient come with a history of intermediate abdominal pain, and if X-ray advised to the patient, there is a small stones seen in the pancreatic duct in the X-ray findings. So these all are the three kind of diabetes which are the type 1 patient having. Type 2 diabetes having two types, that is it can be found obese patient and non-obese patient in both conditions, which we discussed already. So it can be the sign or symptom we can observe in the patient. In the next slide we are going to discuss about what are the sign and symptom of the diabetes and how they will occur, that we will going to discuss later on. Okay, the first symptom or in the diabetes, it is polyuria, that is excessive urine passage. Second one is polyphagia, excessive appetite. Third one is polydipsia, that is excessive thirst. Fourth one is hyperglycemia, that is elevate the level of glucose in the blood. Fifth one is glycosuria, that is passage of sweet in the urine or glucose in the urine. And sixth one, in some cases weight loss is there, or we can say the weight gain is there. That is depend upon the type 1 and type 2 diabetes. In type 1 patient, basically weight loss is there. In type 2 diabetes patient can gain the weight. So these are symptoms of diabetes. So in next slide we discuss how the symptoms occur. One by one we will take all the previous symptoms, and how they will occur we are going to discuss later on. The first symptom is glycosuria, that is excessive glucose in urine. So two conditions happen. One condition is normal condition and second one is abnormal condition, that is in diabetic patient. So in normal condition, what happen, if we are taking the excessive glucose in the form of carbohydrate, or we are taking excessive sweet taste, so glucose get automatically increase in blood. In normal condition, insulin starts secretion by that time, and it change the fat, the glucose into the fat, because that is excessive glucose. If we are taking the normal glucose level, then it going to change into glycogen and store in the liver and elsewhere cell in the body. But if we are going to take excessive glucose, that I already discussed in the pathology part of this web series, that is in the third video, I already discussed about that. So excessive glucose change into the fat by the process of lipogenesis in the presence of insulin, and that fat found in the form of fatty acid and triglyceride and stored in adipose tissue. So this is the normal condition which happen in the presence of insulin. Now we are going to see in abnormal condition, diabetic condition, when glucose when insulin absent in the body, absence will be there. So patient having the excessive glucose in the blood, that glucose reaches to the kidney, because it's not going to change into any fat because there is lacking of insulin. So that glucose reaches to the kidney, and till a threshold, kidney having a threshold, until that threshold kidney absorb that glucose. But when that threshold get crossed, the glucose start enter into the urine, and this condition is known as glycosuria, and that glucose start coming into the urine. So this is the first symptom we discussed, and how the condition happen in normal and how that condition happen in abnormal condition, that is in the diabetic condition. So in now we are going to see the next symptom. Okay, the next condition, it's uria and polydipsia. Both are very simple and can be discussed together. So due to excessive amount of glucose in blood, it results osmotic effects. That result the excessive amount of water pulled out due to that osmotic effect, and this lead the polyuria, and this polyuria results to lead the polydipsia, that is excessive thirst due to large amount of loss of water from the body. So these both are symptom which can be explained very much simply. The next symptom, that is polyphagia. In this condition, glucose not available for the energy inside the cell, because the condition how it happen, because the glucose is not going to change into glycogen due to lacking of insulin. So next option, what the cell having to getting the energy, that is protein and fat breakdown. By that the cells are going to getting the energy, but due to lacking of that glucose, the cell get starving for energy, so they send the message to the brain to turn person's appetite. So craving for the food occurs in the patient, and this condition is known as the polyphagia. Okay, so these are the sign and symptom which appear in type 1 and type 2 diabetes, and we will see what is the difference between them and what are the common symptoms occur in both type of diabetes. So first one is weight. So in type 1 diabetes, weight loss will be there in patient. Patient will come to you with a very lean and thin situation. In type 2 diabetes, there is increase in weight. Patient come to you with obese or in normal weight also. Second symptoms, that is the blur vision, that can be found in type 1 and type 2 diabetes because due to the complication of retinopathy. And next one is fatigue. It also can be found in type 1 and type 2 diabetes both. And next one is glucose impair WBC. See what happen when glucose get excessive amount in the body, it hamper the WBC functioning, and WBC help to protect us from the various diseases, as it is play the important role in immunity. So what will happen in both type of diabetes, it hamper, and there is a streptococcus infection can occur and candida infections can occur in both type of diabetes. Next one is infections. So infection can be occur in both type of any kind of infections, because as WBC function get impaired, and by that any kind of infection can occur because immunity get weaker. Wound healing, next point, 6 point is wound healing. It can be found in both type of diabetes because excessive amount of glucose hamper the function of collagen fibers and all the factors which help in the healing, in wound healing. Next one is in females, that is inflammation of vagina take place in both type of diabetes, type 1 and type 2, and in the male there is impotency can be found in both type of diabetes. And ninth one, that is a recurrent infections that can be found in both type, skin infections that can be found in both type of diabetes. Okay, I hope you understand which I discussed in this video, and to understand diabetes in a detailed manner, you can go through all the videos which I made previously, and in upcoming videos also I will make, so you can understand diabetes betterly with this. Thank you so much.